Welcome back, everybody. Again, we're here with Ashley Beto from the American Cancer Society. We've been talking about the Making Strides Against Breast Cancer Walk, and we'll have all that information for you again in just a little bit. But we want to shift gears a little bit because you guys are constantly working with people to raise awareness of early detection and how to get treatment for cancer. And with October being Breast Cancer Awareness Month, this is really the focus right now.
It is. This is our big push this time of year, every year, to remind women of the screening guidelines for breast cancer, to go talk with their doctor about it. If there's a family history, share that with your doctor and all that type of stuff.
Sure. What are the ages where you need to do all these different things? Because I feel like it keeps changing. No one really knows. And I think it's really easy to say, oh, that's for older people and I'm not there yet, no matter what your age is, and just kind of slough it off.
Well, exactly. And a lot of times we don't think, you know, starting at age 35, we encourage women to get a baseline mammogram. Okay. So that's something that they can take with their doctor when they turn 40, when they start their yearly mammograms, to kind of judge off of and make sure there were no significant changes. So 35 is pretty young in the grand scheme of things.
And that's not something we would think about. I always hear, you know, I think sometimes I hear 50, a lot of times I hear 40. No one has ever said, like, oh, you need to do one early so we know what normal is for you.
Exactly. And with a lot of the changing guidelines just across the board, you have different organizations saying different things. The American Cancer Society has always stuck with, we recommend for women starting in your 20s to do self-breast exams on a monthly basis, because that way you're familiar with your body and you know if there are any changes.
Sure.
Then when you move into the 20s and 30s as well, we recommend clinical breast exams, so a breast exam done by a doctor's office at least every 3 years. For some women, it'll happen more often. A lot of times they pair it with the Pap test.
Right, or just a general physical.
Exactly.
Yeah.
So with that being said, then when you get into your 40s, we recommend yearly mammograms for all women, as long as they're in good health, and then also combined with a clinical breast exam. And that also is combined with your self-breast exams, which pretty much don't stop for the rest of your life.
Sure. Now for mammograms, I think a lot of people are a little bit squeamish about it. They say, oh, it's gonna hurt, or it's not worth going, or I mean, but that mammogram can save your life.
It can. When you look at the size of a lump that a mammogram can detect versus when you would actually be able to detect it yourself if you were doing a self-breast exam, there's significant size difference, and that's huge. I mean, the earlier you can find a lump, or the earlier you can find cancer, the more likely you are to have a successful outcome with it.
Because once you find it, it's important to start treatment as soon as possible, right?
Yep, and treatment does vary. It depends, it depends on the stage of the cancer, it depends on your personal history. There's a lot of things that go into determining for the doctors what they're gonna do to treat you.
But just like HIV and AIDS, this is not the death sentence that it once was. When you hear the word cancer, everyone thinks, oh my God, panic, but there's so much that they can do that they didn't used to have.
There's a lot of different things. We have different drugs that can be given to women after they are diagnosed and in remission to help prevent it from coming back. Okay. We have different treatments that they use for women who are going through breast cancer now. We've come a very long way, but as with any disease, not even just cancer, outside of cancer, we have a long way to go.
Sure. Are there any other tests that the doctor could run that are looking like in the future they'll be more effective than a mammogram, or is a mammogram going to be it for a while? Is that like the best bet to find it?
There's a lot of research being done. Even here locally, there's a lot of research that's being done, which is awesome.
Yeah.
But until they've been tested and proven and approved by, you know, all the approving organizations, then for right now, this is what we have. It's amazing though when you look at the statistics before the mammogram was put into use. Yeah. Breast cancer was pretty much not diagnosed at an early stage, it was diagnosed at a later stage, and you had more women dying from it. Once the mammogram became a more common practice, we have less people who are actually dying from the disease. We're seeing more people being diagnosed, but that's good because we're catching it early enough.
Oh, okay, so an increase in diagnoses is good. Mm-hmm. That makes sense. I wouldn't have thought of that.
Yeah. Because in the back end of it, you have fewer deaths because of it.
because the rate may still be the same. That's interesting. I never even thought of what they did before mammograms were available, because my whole life I've always heard about mammograms.
Exactly. For our generation, it's, you know, this is common practice, but when you get into older generations, there's a little bit more hesitation. Even with generations being said, other ethnic races and groups, there's other hesitations that we see when it comes to this type of stuff as well. So there's a lot of barriers we still have to kind of knock down and just educate women about awareness.
For somebody who's sitting out there right now watching and saying, yeah, that's great, but I just don't feel comfortable going, what is the most important message to get to people who are just a little bit scared or just a little bit hesitant to do it?
Just begin by talking with your doctor. They can kind of give you a step-by-step of how it's going to work, what it's going to be like. They can also share with you the importance of it. And it really is important to your life. Breast cancer, just like any other types of cancer, I mean, they can be, early detection methods are life-saving. And the earlier we can find it, the better off people are going to be.
Now, you talked about self-exams starting in your 20s, but I knew somebody who did a self-exam at 16 and found a lump, and it turned out to not be cancerous, thank goodness. But is this something that parents need to be telling their teenagers about? I mean, I remember in high school being told to do this.
Yeah, I mean, it definitely does not hurt. Yeah. We do have people that are diagnosed, you know, under the age of 20, under the age of 30, under the age of 40, but it's rare than the older, anybody 40 and older being diagnosed.
Gotcha.
As a woman ages, their risk for developing breast cancer increases.
Is there any sort of genetic link, for example, if your mother had breast cancer or your grandmother had breast cancer, should you be starting your own exams earlier?
Talk with your doctor.
Okay.
They have identified genetic links to breast cancer to make you, to determine if you're at a higher level of getting breast cancer.
Gotcha.
So there is testing that can be done. For people who don't test positive for being a carrier to that specific gene, they still will encourage you to do different types of testing. Some people have to do MRIs if they're at a higher risk, combined with a mammogram on a yearly basis. They have a lot of different things that they're trying, which helps to catch things early.
Yeah, which is really the most important thing. We need to take a quick break, but when we come back, we're going to talk about some of the programs you guys have available. If you know somebody who's been diagnosed with cancer recently, these programs can be such a huge help, just physically and just emotionally, for all the support. If you want more information on any of this, go to cancer.org, or you can give the American Cancer Society a call. That number is 1-800-227-2345, and the local office here, this phone number is 229-1287. We'll be right back.